Greetings, Fallon Health Durable Medical Equipment providers. Welcome to your Durable Medical Equipment MedTrack Portal training session. In this training, we are going to cover the following topics: how to access your authorization, how to return an order back to us, how to request an authorization extension, and how to access the referring documentation that we received from the referring source. Let's begin. After having been granted access to the MedTrack portal, we will navigate to the MedTrack sign-in page where you will enter the email address you assigned your account profile with. Please disregard the Register Now tab. The Register Now tab is only used internally by IHCS staff. At the bottom center, you have a Forgot Password option. If you happen to forget your password, simply click on Forgot Password. MedTrack will then send you a new link for you to recreate your password and regain access to your account on file. Here you will enter your email address and your password and simply click on Sign In. Once you have signed in, you will be directed to your home profile page. Notice here towards the bottom you have an announcement section. The announcement section is used for integrated home care services to share any information with network providers, such as portal enhancements, portal updates, interface changes, and health plan communications. Looking at your main profile page, you'll notice if you have been granted portal admin access, you will have access to the following 4 tabs: the DME Orders and Auths tab, the Request Queue, the Support tab, and the Manage Users tab. If you have been granted standard user access, you will only have access to the following 3 tabs: the DME Orders and Auths tab, the Request Queue, and the Support tab. Now, we're going to be going over a brief description of what the functionalities are for each specific tab before we actually jump into them. The DME Orders and Authorizations tab is going to be used for you to access your authorization, view referral documentation from the referring source, view patient information, and view order notations and delivery instructions. You're also going to have the option to identify the referral coordinator who prepared the order and assigned it to your agency, the ability to return the order back to us if it cannot be serviced, and the ability to file for an authorization extension request. Moving on to the next tab is the Request Queue. The Request Queue allows you to track the status of your requests. So in the DME Orders and Authorizations tab, if you did file for an authorization extension request, you can track the status of the request in the Request Queue. You can check to see if the request has been approved or still pending to be approved. You also have the option to update a request and also cancel a request if need be. The next tab is a Support tab. By simply clicking on the Support tab, MedTrack will display our contact information for outreach. So for any support inquiries, you can give us a call at 844-215-4264, option 4, or email us at the following supported email addresses. The following tab is the Manage Users tab. The Manage Users tab will give portal admins the ability to grant additional user access within your organization. So if you have been granted portal admin access, you can edit user profiles and accounts, reassign different MPI locations to specific users within your organization, resubmit registration links, and even revoke user access. So let's begin with the Manage Users tab. By clicking on the Manage Users tab, you will be directed to the Manage Users page. Here you have 2 options and 2 options only: to add a new user or to search by existing users within your organization. Let's start off with adding a new user. Simply click on Add User, and that's going to bring you to the Add Users page. Here, as a portal admin, you have the ability to grant additional user access to either another portal admin or to a standard user. Notice as I toggle back and forth between a portal admin and a standard user, the location field goes away when portal admin is selected. The reason for that is because all portal admins have what is called global access. Global access consists of portal administrators having the ability to access authorizations and orders for multiple tax IDs and NPI locations a provider operates under. On the other hand, for standard users, you can select the specific NPI location or locations that a standard user will be working or based out of. Next, enter the associate's first and last name, including their email address. Select the proper corresponding NPI location that the user will have access to. EFT permissions will not need to be enabled for Fallon Health portal users. Once all of the corresponding information has been entered, simply hit Save. Once you hit Save, the user will receive an alert from MedTrack to their email address, prompting them to set up a password. Once the user clicks on the link, they will be prompted to set up a password, and they will now have access to the MedTrack portal. It's very important to keep in mind that by default, as a security feature, once you grant user access to a user, the registration link they are receiving via email will only be good for 24 hours. After a 24-hour time period, the link will expire and you will have to resend a new registration link to the user by clicking on the Edit User tab and clicking on Resend Registration Email. Now back to the Manage Users page. Let's talk about our second option, searching existing users within the portal. Here you can search a user by NPI locations, existing user's first and last name, even the user state, whether their account is active, expired due to inactivity, account revoked, and the list goes on, containing different user state options you can search by. You also have the option to search for general results. By leaving all 4 fields in blank, just simply hit Search. MedTrack will then generate those results for you under the Results section. As you see here, I have a total of 37 users. The first column will break it down by the user's first and last name. The second column will give you the user's email address. The third column will give you the user type, whether it is a standard user or a portal admin user. The following column will give you the location that's been assigned to that user. If it's multiple, it will state multiple. The following column gives you the user state the user is currently in. And the last column gives you the option to edit a user's profile. As a portal admin, you can simply click on Edit User for an individual user, and that's going to bring you to the Edit Users page. Here you have the options to upgrade a standard user to a portal admin. You have the option to upgrade an existing email. You have the option to modify, remove, or add existing NPI locations for a user's profile. You also have the option to revoke user access if the user no longer needs access to MedTrack. And you also have the option to resend a new registration email if that registration link expires within the 24-hour time frame. At the bottom, you have a history of events with a date and timestamp of when the user was first granted access. You have a date and timestamp of when the actions were changed and who prompted the changes within your organization. You have the user status column to see the current user state and the email address. That does it for the Manage Users tab. Now let's move over to the DME Orders and Authorizations tab. By clicking on the DME Orders and Authorizations tab, you will be directed to the DME Orders and Auth Management Filters page. Here you can search your orders by state, NPI locations, date parameters which can be modified and removed. You can search by authorization number, patient's first and last name, or member ID. Keep in mind, you do not have to enter information on all 4 search fields. One search field is fair enough to generate your result. Please note that when we submit an order to your agency, you will get an email notification to the subcontractor email on file containing the authorization number. That's the same authorization number you will use to access the order information in MedTrack. Simply copy and paste the authorization number into the search field and simply hit search. DME authorizations generally begin with a D and a dash. Now let's talk about the order status. By default, when logging into MedTrack, you will notice you have scheduled and pending rescheduled. Scheduled order statuses represent newly assigned orders to your agency location, while pending rescheduled order statuses represent a reschedule request from a patient, meaning that a patient requested an alternate date and time for you to deliver the items to their destination. Once you have entered the corresponding information into the search fields, whether you selected the authorization number, the patient's first and last name, or their member ID, simply hit search. Once you hit search, MedTrack will generate those results for you under the results section. The first column will identify the name and NPI location the order was assigned to. The second column will list the authorization number. The third column displays the priority in which the order was tagged and assigned to your agency. It's important to look at routine versus expedited. Expedited orders must be processed within a 24-hour time frame. The next column displays the forecasted scheduled delivery date that we placed on the order for the items to be delivered to the patient. The next column is the order status, which represents scheduled. Keep in mind, all newly assigned orders will be listed as scheduled, representing a new scheduled order to your agency. The next column is the patient column, displaying the patient's first and last name and their phone number for immediate outreach and delivery confirmation. Notice in the patient column, the patient's first and last name contains a blue hyperlink. By clicking on the patient's first and last name, you will then be directed to the patient's details page. Here you will have access to all of the patient information, such as the patient's home address, date of birth, height, weight, emergency contact, patient comments, insurance information, medical details, physician details, ordering physician details, and patient notes. Back to the DME orders and office management filters page. Lastly, here you have the details column. By clicking on details, you will be directed to the authorizations details page. On this page, you will have all the information needed to proceed with rendering your services. You will have the ability to access your authorization, access the referral documentation, identify the IHCS referral coordinator who prepared the order, view patient information, view delivery instructions, view order notes, and have the ability to return an order back to us if you cannot service the request. Okay, so let's start at the top left-hand corner. Notice the authorization number contains a blue hyperlink. By clicking on the authorization blue hyperlink, MedTrack will generate the authorization for you on the top right-hand corner of your screen in a PDF format. Simply double-click on the PDF file for your authorization notification to populate. Looking at your authorization, you will notice at the top, your agency name will be listed, followed by your agency NPI location, followed by the authorization number. Here we have the date parameters that we've approved for the services to be rendered. Under that, you have all the corresponding member information. We have also added the diagnosis codes for the patient along with the service codes approved for the patient to receive. Notice at the bottom, your authorization contains a special instructions section. Generally, the special instructions section provides you with the referral coordinator's contact information for any inquiries that you may have regarding this order. Please use the information provided to you for outreach. Back to the authorizations details page. Under the authorization number, you have the auth span that we generated for services to be rendered. the MPI location that the order was assigned to. Under that, you have the fax titles. Notice under the fax titles, you may see one or multiple PDF attachments. Those PDF attachments consist of the actual order information we received from the referring source during the prior authorization request. Under that, you have an issued by section. You will notice a first and last name. This is the IHCS DME referral coordinator who prepared the order and assigned it to your agency. Under that, you have the primary care physician, the referring doctor, and all of the member information along with their phone number, email address, and home address. Here you have a first viewed by section. The first viewed by section lets Integrated Home Care Services know which staff member representing your agency first logged into MedTrack to view the order. The following we have delivery details, a delivery phone number along with a delivery address, as well as delivery instructions. We've also listed the order priority again for you and the forecasted scheduled delivery date. Here you have a section to add delivery instructions. If you need to share any specific delivery instructions to any other staff members internally, you have the ability to add those specific instructions on the delivery instructions field. At the bottom, you have a delivery outcome section, which showcases the item's delivery type and sale type. The same exact equipment that's listed here in the delivery outcome matches exactly to what's on your authorization. Please be advised that based on recent determinations, the aforementioned sections of the form are not required to be completed. This includes the fields for arrival and departure times, which can be left in blank. Additionally, the collection on delivery section and proof of delivery section also do not need any information entered at this time. Furthermore, Fallon Health durable medical equipment providers are not required to upload proof of delivery documentation. These changes streamline the process and eliminate the need to provide these specific details. All Fallon Health durable medical equipment orders that are assigned will be systematically closed out internally by Integrated Home Care Services staff members. The delivery receipt history section will also not pertain to Fallon Health durable medical equipment providers. Towards the bottom, you have an order notes section with all the order notations made internally by the DME referral coordinator who prepared this order and assigned it to your agency for viewing. Please note that as a provider, you do have the ability to add order notations. We don't encourage to use the order notes section as your primary source of communication. If it's an important inquiry, we highly encourage you to give us a call and request to speak to the assigned referral coordinator. Scrolling all the way to the bottom, you have the referral status history section from the time that the referral was originated and assigned to your corresponding agency. Now let's scroll all the way to the top and look at your options for returning to QA. As a portal user, you have the option to return an order back to Integrated Home Care Services if the order cannot be serviced. By simply clicking on Return to QA, you will be prompted to the Return to QA page. Here you have the reason for returning to QA, which can be filled out with the following examples. Items not in stock, patient refused services, no patient contact, patient deceased. Once done, simply click on Return to QA and the order will then be submitted back to Integrated Home Care Services so that the modifications to the order can be made, including canceling out the order or assigning it to an alternate network provider. Now let's talk about the options for an authorization extension request. Keep in mind, once this order is systematically closed out for you internally by an Integrated Home Care Services staff member, the order will then shift into a complete order status. When filing for an authorization extension request, keep in mind the order status must be updated to complete in the search field. Navigate to your home page on the DME Orders and Office Management page. Select Complete Order Status. You can either enter the authorization number, the patient's first and last name, or their member ID and hit search. Once the result is generated, you will simply then click on Details. At the top right-hand corner, what used to be the tab for Return to QA has now transitioned into a Request for an Authorization Extension tab. You only get this option once the order is systematically closed out by Integrated Home Care Services. You now have the option to request an authorization extension. simply click on the Request Authorization extension. You will then be directed to the Request Authorization extension page. At the top, you have an order number followed by the patient ID and name, the current authorization expiration date, all of the items that we approve for services, and the new authorization expiration date you are requesting. An example of requesting an authorization extension consists of entering a future date you want an authorization to expire. You can enter that date here. You have the ability to add any specific notation that you want to share for this request. You also have the ability to upload supporting documentation for the request. Supporting documentations may consist of any updated prescription or updated scripts received from the prescribing physician or the primary care physician for the patient. Once you have all the pertinent information needed, simply hit Submit Request. You will notice on the top right-hand corner of your screen a green pop-up window stating the request has been submitted successfully. Now let's move on to the request queue. On the request queue, you're going to have the ability to track the status of your request. The typical turnaround timeframe across the board for all requests are 1 to 3 business days, 24 to 72 hours. Let's go ahead and click on the Request Queue tab. You will then be directed to the Request Queue page. Here you have different search fields you can search by. At the top, select your state and MPI location, the start date of when you filed your request. Enter the patient's first and last name, or their member ID, or the order number. Remember to keep in mind, one search field is fair enough to generate your result. You can also select in the Request Type section a specific request type you are searching for. You also have the status filter you can search by. You can search by New, Pending, Processed, Canceled, Partially Processed, and Auto Approved. Once you have the corresponding information, simply hit Search and MedTrack will generate the results for you. Once the results are generated, the first column will show the name and MPI location the order was assigned to. The following column will showcase the date the request was made. The following column the type of request that you processed. The order number column with the corresponding order number, which is the same as the authorization number. The status column that shows if the order has been processed or pending to be processed. Following that, you have the patient column with the patient's first and last name. And lastly, you have the details column where you can click on details and view the authorization extension request. Here you have the request details listed as the following: order number, patient ID and name, current authorization expiration date, when the request was created, the requested authorization expiration date, and lastly, the request status. You also have the items listed on the current authorization as well as a notes section. At the bottom of the auth extension request page, you can add additional notations. You can upload any additional supporting documents, and you also have the ability to update and/or cancel an existing request. Examples for canceling a request can vary from: patient is refusing further services from your agency, the patient has been transitioned onto a new healthcare provider, and/or the patient has unexpectedly expired. By canceling a request, you can simply just click on Cancel Request. You will then be prompted with a pop-up window stating, "Are you sure you want to cancel this request?" And those are your functions and navigation options on the request queue. This concludes our Fallon Health Durable Medical Equipment Provider MedTrack training session. I hope you have enjoyed this instructional training video. If you need any additional assistance, please contact the provider training team at providertraining@ihcscorp.com, or you can call 844-215-4264, option 4. Thanks for watching. Catch you on our next video.